Hello, so for those of you who are new here, I have inattentive ADHD, cerebral palsy, major depressive disorder, and generalized anxiety disorder. I'm currently taking 10 milligrams of the antidepressant Trintellix and 25 milligrams of the stimulant medication Mydayis for the inattentive ADHD. In a previous video, I said that I was taking 20 milligrams, but I was wrong. Initially, I was taking 12.5, and I took that for a couple months, and then my provider recently increased it to 25 milligrams. So I don't know why I kept saying 20 milligrams. Anyway, I mentioned in a previous video that ever since she increased it, pretty much doubled it, I was feeling nauseous pretty much every day, every morning. And initially, I thought it was because I wasn't taking breakfast with the medication, but that was not the case. And then recently, I've kind of started to skip my medication unintentionally because I have a graduate school and all these things going on. But I've noticed that I've been skipping like one day on, one day off, and that has actually uh, decreased my nausea. So I don't feel nauseous anymore. So I don't know if I want to keep doing that because I do feel some side effects on the days that I don't take the stimulant medication. I feel very lethargic and I have a like lack of energy and not depressed, but just like really no energy to do anything and tired. But maybe my body will get used to this one day on and one day off thing. So if it's something that you've tried in the past and you think that it's worked well for you, let me know. I'm not suggesting that you do this. Of course, I'm not a professional. And always consult with your provider prior to making any changes to your medication regimen. Because this is just a personal vlog and I just kind of talk about my symptoms and how I deal with the medication and all that. This was my first week in graduate school. For those of you who don't know, I am currently working on my master's degree to get my degree in speech and language pathology, which is the degree that you have to get in order to become a speech therapist. So first you have to get a bachelor's degree and then get accepted to speech and language pathology graduate school, which is really competitive. I think it's something like 39% of applicants get into master's program because there's just not enough seats in each program. So I got my bachelor's degree this year in May, and then so my senior year I started the application process to get into the master's programs. I applied to a total of six different schools here in Southern California, and I got into two of those. One of them being the University of Redlands, which was my undergraduate school where I got my bachelor's degree, and the other one was Cal State San Marcos, and that's the one that I'm currently attending because it's a part-time online program and it just fits well with like parenting and my part-time work schedule and trying to run a business from home with my graphic design and t-shirts and invitations and all that stuff that I do on the side. Um, but yeah, so this was my first week, and the professors so far have been really supportive, and I like that they kind of provide a very welcoming environment. They really make it seem like they really care about their students and they're there to mentor us as we kind of embark on this journey of uh, becoming clinicians, right? We're going to eventually get into clinical practices where we have to work with different populations because for those of you who don't know, the field of speech and language pathology goes much more beyond just dealing with speech disorders, like helping kids learn to talk. We do deal with stuttering and we help kids who may be nonverbal, kids who have autism, but we also actually um, are supposed to be the experts in swallowing disorders, also known as dysphagia. So if somebody has a stroke and they have difficulty swallowing, we also treat that. We deal with patients with Alzheimer's and dementia and memory issues, as well as a lot of speech therapists work in skilled nursing facilities. Some of them work in clinics, some of them work at the schools. And let's see what else is there. There's a pediatric. We also deal with voice disorders. So if you're like a singer and you damage your vocal cords, we also learn to treat that. So the scope of the practice of speech language pathology, it's really wide, which is one of the reasons that I started kind of looking into the field. And one of the things that drew me to it is that there's so much variety as to what you can do and where you can work. So if you decide you don't want to work in the schools and work with kids anymore, you can work at a hospital, at a skilled nursing facility, et cetera, et cetera. Um, and then one of my first classes that I'm taking is neuroscience. And I've always been fascinated by the brain. I think partly because I have cerebral palsy and I feel like I have so many unanswered questions. And even though I have been to a neuropsychologist and been to a neurologist, I feel like there's only so much that they can answer. Um, and it got me thinking that maybe I want to get into possibly getting my PhD sometime in the future and going into research to answer my own questions regarding cerebral palsy, because I want to know why I startle so much. I know it has something to do with cerebral palsy, but what areas of the brain exactly? Does it have to do with a part of the area of the brain that was damaged when I was younger? Why do I startle so much? Why do I have no sense of direction? Why is my perception so bad, like my depth perception? So these are all questions that I've had. Uh, as far as having cerebral palsy, I feel like a lot of the times the doctors and providers and specialists at schools that we work with, will try to treat what's obvious when somebody has cerebral palsy, whether they're in a wheelchair or whether they limp like I do. Like I walk, but I walk with a limp and I have terrible balance and my posture is pretty bad. And I feel like it's easy to kind of try to treat what you can see. But for me, I feel like the cognitive implications and the psychological implications of having this disorder is really, this condition of cerebral palsy is really um, what has made a bigger, like, negative impact in my life, more so than just walking with a limp. That I can deal with. The physical implications of me having mild cerebral palsy haven't affected me nearly as much as some of the cognitive deficits that I feel I have, like the fact that I have no sense of direction, the fact that I'm constantly getting lost, the fact that I'm constantly getting startled, and that I haven't been able to learn to drive. So, as I was pondering all this, I was thinking in the future maybe I could get into a doctorate program to do research in the field of cerebral palsy and try to get some of those questions, those unanswered questions, answered. Anyway, yeah, uh, there we go. There you go, startle me again. That's it for now.